So, a warm welcome to everyone, and my topic is idiopathic pulmonary fibrosis serum proteomic analysis before and after nintedanib therapy. I am Vaishnavi, currently pursuing my B.Pharm at KMCH College of Pharmacy, affiliated to the Tamil Nadu Dr. MGR Medical University. So, proceeding with my uh, presentation, the author Claudia Landi has to accredit more than 88 publications and is an expert in serum proteomic analysis and identification of protein biomarkers. So, idiopathic pulmonary fibrosis is a fatal progressive disease with a median survival of 2 to 5 years. Uh, the Nintedanib is a drug which reduces IPF progression, significantly slowing the annual decline in forced vital capacity. It just slows the progression of the disease. So, very little data has been analyzed and retrieved regarding the pathogenesis, and this study aims to uncover more truths. So, the research question was to identify proteomic biomarkers in idiopathic pulmonary fibrosis. The manuscript one identified haptoglobin related protein as potential biomarker. So I've selected this so that a functional when a functional proteomic approach is applied to a drug in to highlight the drug induced molecular pathways, its modifications and corresponding response can be analyzed, and we could get a better idea to validate the action or activity of the drug and identifying and ensuring that haptoglobin related proteins can be considered a potential biomarker. So methodology involves in 6 IPF patients whose diagnosis was confirmed according to the ATS ERS guidelines at Siena Regional Referral Center for Interstitial Lung Diseases. Lung function, radiological, histological, immunological tests were performed and recorded. The blood gas analysis was also done to ensure the status of the patients, and the drug administered was the nintedanib, which is an antifibrotic drug according to the Italian National Drug Inclusion Exclusion criteria. The dose was 150 mg twice a day for a year. So the functional proteomic analysis was done. The differential spots which were obtained were used to perform multivariate principal component analysis and also the cluster analysis. The differential spots were obtained by peptide mass fingerprinting, and the haptoglobin abundance was validated by 2D Western blot and ELISA in a new set of cohort samples. Also, a pathway was made using a Metacore software version 6.8 to identify the proteins involved and their possible mechanisms. So as you can see in the results, there is this T0 is before administering nintedanib therapy, and this is after. As you can clearly see, there is a corresponding increase after a year, and haptoglobin has previously been proved to be a potential biomarker which increases it in serum levels in the due course of their disease progression. It is linked to activating many other receptors which may aggravate the disease, and but the other proteins which have been identified, this albumin, which is an which plays a role in reducing the oxidative stress, such as reducing the oxidative damage, and immune globin heavy constant alpha 1 is responsible in immune reactions, and this antithrombin has a negative inhibitory role in the procoagulation pathways, so that it reduces the fibrotic fibrosis formation, and recruitment of macrophages and neutrophils has been inhibited by apolipoprotein C3. So this is the gel master gel for the proteomic analysis. As you can see, there is this albumin which has been increased, and antithrombin 3 here, which has also been increased. And in the there is also 6th and 13th position was haptoglobin, as you can see here. These spots have also been elevated. The lung function test, which revealed restrictive deficit, and there was a mild increase in neutrophils after 1 year, and in the BAL analysis, which is bronchoalveolar lavage analysis, and the serum analysis for KL6 also was increased. So, but the other analysis of serum biomarkers were not as significant. Even the identified protein biomarkers, there was no significant variance, or a wide variance was not observed. So this is the pathway map which was built by Metacore software. As we can see, this heptoglobin and this VEGFR, PDGFR, and FGFR, these are our main targets of the drug, which have proved to act through many pathways. STAT3, STAT5, and CREB1 and CBP are the main proteins involved in exaggeration of the disease, or sudden exacerbations during the progression of the disease. These drugs are involved in immune responses, oxidative stresses, inflammation, and fibrotic initiation, and so many roles. So this heptoglobin has been shown to interact with these proteins, these STAT3, STAT5, and CBP proteins directly, which is involved in the induction of pro-inflammatory cytokines and recruitment of other inflammatory cells. As you can see, the green lines represent the inducers, and the red lines represent the inhibitors, and this blue line represent the well-known canonical pathways. And this our drug nintedanib has also shown inhibition of PPAR gamma and PPAR alpha, which are involved in inhibition of apolipoprotein C3, which is also important to reduce the inflammation and other diseases, other complication related to it. This antithrombin is involved in preventing the procoagulation pathway, and this albumin reduces the oxidative stresses. So, on identifying that haptoglobin has been increased, haptoglobin abundance is also was confirmed by performing two-dimensional Western blot and ELISA. Though this is the result of Western blot, where we can clearly see there is not such a significant increase, but there is, of course, a certain increase or abundance of haptoglobin before and after nintedanib therapy. As I previously told, nintedanib can only slow the progression of the disease and not avoid manage the symptomatic relief, not a complete cure. It's just an antifibrotic drug that can, a tyrosine kinase inhibitor that can slow the progression. So this new cohort was composed of 10 healthy samples, 14 IPF patients, and the test was done on the patients before and after nintedanib therapy. So this is the control. This is before nintedanib and after nintedanib. As you can see, on the due course of 1 year, definitely the haptoglobin has increased in serum levels, and the haptoglobin abundance has been proved. Next, this is the pathway map of the various diseases and pathologies related to the identified biomarkers. These orange bars represent the p-values of analysis performed on differential proteins found between T0 and T1 samples, and the light blue bars represent the p-value of analysis obtained uploading together the differential proteins found and the targets of nintedanib, both. So we can see that there is a, increase or uh, improve or a higher chance of developing these uh, embolism, thrombosis, and dermatitis, exfoliative keratosis, and seborrheic keratosis, and the spalm. But other diseases are of lesser chances, and also there is a higher chances of blood coagulation, inflammation, cell adhesion, and such. They are um, all such dangers. But it when it is compared to the T naught sample or the differential proteins, the discussion. So for in the discussion, there were 13 spots which were identified and all increased in abundance after 1 year of treatment. They were all proteoforms of albumin, heptoglobin, antithrombin 3, apolipoprotein C3, immunoglobulin, heavy constant alpha. So the principal component analysis demonstrated homogeneity and limited variance of the data. So as I told, there is not a significant difference in the protein biomarkers, but if there is a significant reduction in heptoglobin, we can surely consider it effective treatment. So in during the further therapies or further drug discovery or analysis, we can consider heptoglobin to be a trustable or reliable biomarker. This nintedanib has known to inhibit these three proteins, and merging these proteins with the differential proteins and performing the metacore enrichment analysis highlighted possible causes of this abundance of these five proteins in serum. These all proteins were related. Previously, we only studied with just the differential protein, which didn't show much correlation. But on merging them with the targets of nintedanib, showed a better analysis and gave a better understanding. Then this proves the central role of heptoglobin after nintedanib treatment. Also, it validates the behavior of haptoglobin in a wider cohort of samples, as we have analyzed in all those samples of IPF patients. It was definitely increased. Heptoglobin has increased as the disease progresses. So the nintedanib is a drug with anti-fibrotic, anti-proliferative, and anti-inflammatory properties. It has been approved for IPF as well as lung cancer. The progression of IPF may lead to lung cancer. So it is important and essential that we monitor and the disease, and also the timely diagnosis of the disease, and less invasive biomarkers like serum biomarkers can prove to be very helpful in easy diagnosis and timely treatment uh, uh, starting. So these uh, these STAT3, STAT5, and CREB binding protein, which are inhibited by nintedanib, are involved in the upregulation of heptoglobin. So when our drug reduces these or inhibits these three proteins, heptoglobin increases in serum. So that is what is happening. So we should also reduce the heptoglobin because it puts a higher oxidative stress on our patients. And also the inhibitory signal of PPAR gamma and alpha due to the effect of nintedanib on PDGFR is crucial and regulating epithelial mesenchymal transition and prevents that conversion of IPF into lung cancer. So the 13 differential protein species identified in serum IPF after 1 year treatment, and especially heptoglobin are a candidate for potential theranostic marker in nintedanib action. So I conclude my presentation, and this is my reference. Thank you.